Welcome, everybody. Linda Bean from the Kellyanne Dolan Memorial Fund. Thank you for joining us for Shining a Light. We are going to get into a pretty serious topic tonight to shine the light on sickle cell disease. And pretty timely, got a call yesterday in the office from a very tearful mom relocating back to the area after her daughter just experienced a sickle cell crisis. It's a very debilitating disease. We're going to learn a lot more about it today. So I want to welcome to the studio, Tracy Johnson. Hey, Tracy.
Hello, how are you?
I'm good. How are you doing?
I'm well, thank you.
We're delighted to have you as a guest. Tracy is a board member at the Kellyanne Dolan Memorial Fund. She's a school teacher in the city school district, and she is also mom to two young men who live with the illness, sickle cell disease. Fine looking, good, accomplished men, Christian and Christopher. So good to see them by picture. So Tracy, I'm wondering, we know this is a disease that affects 100,000 people globally. I mentioned it's very debilitating. It particularly affects individuals with African descent more than any other. So let's start with the basics. Break it down for me. What is sickle cell disease?
So sickle cell disease is an inherited blood disorder that affects red blood cells. And people with sickle cell disease have red blood cells that contain mostly a hemoglobin S, which is an abnormal type of hemoglobin. And with a hemoglobin S, sometimes these blood cells they are most often crescent shaped. So a normal red blood cell looks more like a donut. And instead of sickle cell looks sickled shaped, hence the name sickle cell. And because of their shape, they have difficulty moving through your veins, right? Moving through small blood vessels. And so the sickle shaped blood vessels then commonly causes a blockage in parts of your body. Now, it can be in any part of your body because you get blood flow through any part of your body. And so when those sickle cells kind of coagulate together and become stuck, then it doesn't allow the other hemoglobin and blood flow to flow through the body, and then causes what we call a sickling crisis. And so that happens when the tissue doesn't receive the normal blood flow that it normally does, and can become damaged because of those crescent shaped cells.
Gotcha. And you mentioned, that blockage prevents the flow from moving freely throughout the body. So what's some of the manifestations? What type of symptoms might someone get with that kind of blockage pushing them into a crisis?
Oh, that ranges. So let me first say that sickle cell disease is the most commonly inherited blood disorder in the United States. As we've talked about before, it is most commonly found in people of African descent, but it can also be found with people of Middle East and also Hispanic descent as well. So when we talk about complications of sickle cell, they range. Some normal, what we would call symptoms of sickle cell is number one, the anemia. People who have sickle cell, their sickle cells break apart more easily, and they don't last as long as someone like you or I who do not have sickle cell. And so when they leave, you're left with too less sickle cells, or too less many cells, period, which causes the anemia. So you're always going to have low blood. Low blood equals low iron, right? So the anemia is one big part. In a normal a person who does not have sickle cell, their normal hemoglobin may live at 11 or 12, and a person with sickle cell, a normal base for them could be 6 or 7. So with the anemia, you're also going to get just being tired and lethargic a lot more often. than someone who is constantly replacing those blood cells more frequently. The episodes of pain, we call those pain crises. That's probably the most major symptom of sickle cell, because sickle cell is very episodic. So you can be absolutely fine right now as I am talking to you, and an hour from now, you could be in a full-blown crisis, not necessarily any rhyme or reason. There is something called hand-foot syndrome, which is very common in babies with sickle cell. That's the swelling of the hands and the feet. Because those extremities are like at the lowest parts of your body, that's where like the cells like to kind of congregate and cut off, and then you have that pain crisis, but the hands and feet tend to swell. Another symptom of sickle cell, and probably I know we will get into a little bit later, the most dangerous is fever. Okay, so whenever a child with sickle cell disease has a temperature of 101 degrees, you must go to the emergency room. You cannot tell whether or not that is a viral or a bacterial infection. Viral infections, we know they happen to all of us, right? Can a person with sickle cell disease be more sick because of it? Absolutely. But bacterial infections can only be determined by having a blood test. And because you don't know that, fever is the very first sign of infection. So it is the first symptom that you're probably going to get, but it is the most dangerous symptom. Something else that individuals with sickle cell go through is they usually have delayed puberty. So they tend to be very, very small for a very long time. They eventually do catch up, but it takes a little bit longer for that. I can remember my son being in high school, and he probably looked like he was in middle school. Honestly, they really don't look like they're almost 26 years old right now. So, we can kind of see that, but that delayed growth or puberty also happens. Vision problems, because as I mentioned before, sickling crises can happen anywhere. They do tend to happen a lot behind the eyes, which can cause vision problems for them. And the last complication is probably the sign of a stroke. A lot of children with sickle cell disease are at a much higher risk of having a stroke, because of that blockage can also be in the brain. So that's something to look out for. If you notice that one side becomes paralyzed, or a weakening of the face or the hands or legs, or there's any confusion, trouble walking, sudden changes in your vision, unexplained numbness, a really bad headache, in terms of this being the worst headache you've ever had in your life, then you need to get help immediately.
You shared such critical warning signs that any parent or advocate for a child, nobody knows their child better, and knowing what to look out for is just critical, life and death. I'm curious, is there anything that you can do to prevent the onset of a crisis?
So, well, in terms of how you live every day, you want to make sure that you are getting nutritious meals. You want to make sure you're getting adequate sleep, and you want to try to reduce your stress level as much as possible. But to be honest with you, that's what we all should be doing every day, right? So in terms of something to actually just prevent a crisis, no. Many children with sickle cell disease at birth go on a penicillin prophylactic and a folic acid. And by taking your medication daily, the risk is a little bit decreased, but no, there's no real reason to ward off a crisis. Something as simple as the weather can send you into a sickle cell crisis.
Sure.
Which we absolutely have no control over.
Absolutely. I'm wondering if you would share a little bit, as a mom and a caregiver to two adult sons now, but what that journey has, been like in parenting two children with the illness.
Sure. So in case you haven't noticed, Christopher and Christian, they're actually twins. and they already came here pretty special because they have a really unique birthday. Their birthday is February 29th, which means that they are actually leap year babies. So we tease them all the time because really they're only 6 years old, right? Biggest 6-year-olds you'll ever see. However, our journey has been quite different for both sons. One, Christian, has had more complications of sickle cell disease than Christopher has had. And that is because when Christian was 5 years old, one of the tests that children with sickle cell are given to help kind of see in advance if they're at risk of having a stroke is called a TCD, which is a transcranial Doppler. And it's basically an ultrasound of your brain. And when Christian was 5 years old, he had some abnormal TCDs, which told us that he was at a significant risk. And actually, I remember the percentage. He was at a 65% risk of having a stroke.
Wow.
Now, in children with sickle cell disease, quite often they have these little mini strokes, which are called silent infarctions, which do not leave a person debilitated because of the stroke, but it does cause like scar tissue on the brain. And so what research has found is that most often, if we can get a child to 10 years old without having a stroke, a single stroke, their chance for having a stroke for the next age group decreases by 50%. Mm. So the goal is to kind of get them to 10 years old without having a stroke. When Christian was 5, that became a real possibility for us. So at that point, it was decided between myself, my husband, and our medical team to put Christian on a program called apheresis, which he would receive blood donations pretty much every month for the next 10 years. Now, going into it, we didn't know how long he was going to be on it. We just knew that this was one of the strategies to kind of help us keep him safe, right? So at 5, we made the decision to put him on the chronic blood transfusion program. And initially, that meant he received a blood transfusion every 3 weeks. So imagine what that means for a family. It kind of changes your family dynamic, right? Because now you have to plan things around him getting a blood transfusion every 3 weeks. And I can remember it was a very daunting day. And my son had to sit with 2 really large needles, one in each arm, because apheresis is a little bit different than a normal blood transfusion, because as you're pulling the blood out, it's being spun, similar to that of dialysis. And then his own plasma and his own white blood cells were being given back to him, but with donor red blood cells. And so, it was the procedure took hours. And it was very, very difficult for me as a mom or my husband as a dad to watch your young child go through something like this. And so I kind of, when he was younger, decided that I'm going to have to do something to make this day, I don't know if you could call it a little more fun, but a lot less daunting. So I came up with Mommy and Me Day. And so we no longer said, oh, Christian, you have to go for your blood transfusion today. I would begin about a week in advance to say, hey, Mommy and Me Day is coming up. And it kind of just changed his perspective, right? It just took something so daunting and just made it a little more fun. And he knew that meant that he was getting picked up from school early. We would go to lunch at his choice. He always got to get something special on that day, whether it was a toy, whether it was a candy bar that I may not have ordinarily wanted him to have. But we just figured out, how do we change something so daunting and so glooming into something that could be, just have a better outlook. because we couldn't change the procedure, right? This is what was keeping my son safe and pretty much alive with the quality of life that we had been so used to.
Yeah,
and so he really began to look forward to it. He was like, oh, mommy, me day is coming up, right? And then it got kind of cute because my husband got a little bit jealous. And he's like, well, how come there's no daddy and me days? We're like, okay, we can make that happen as well.
That's great. You tried to balance it with creating some
Absolutely.
really warm and fun memories. I want to get, because you've made such a critical point, and I want to make sure we cover the resources available. We talk about how essential diversifying the blood donor program is. And I know we've got some resources with a CHOP Red Cross partnership. Tell me a little bit more about that.
So, blood transfusion services through the American Red Cross and the Children's Hospital, the Comprehensive Sickle Cell Program of the Children's Hospital. Years ago, Dr. Kim Smith Whitley, who is one of the leading doctors in sickle cell research, and happens to be homegrown right here at CHOP in Philadelphia, went to the American Red Cross and said, we need Black donors. We need donors for my children with sickle cell disease. Because our blood has these little antigens on it, there's little tags that says, hey, this is Tracy Johnson's blood, and remembers that. We needed blood for sickle cell patients that came from people who look like people who had sickle cell disease. So statistically, African Americans do not donate a lot of blood. So we put out an appeal through the American Red Cross about diversifying the blood supply. How can we get people of color to help out children with sickle cell disease? So for one, about 15 to 20% of children with sickle cell disease at the Children's Hospital of Philadelphia are on chronic transfusion programs. That's a lot of blood, right? Yeah. And so these chronic blood transfusions are really used to prevent reoccurrence of stroke in children who have already experienced or who are at risk of having a stroke. And like I said, they're usually given every 3 to 4 weeks. And so because sickle cell patients at some point, almost often, people with sickle cell disease at some point in their life are going to need a blood transfusion because of that anemia part of it. But the children who are on this chronic transfusion program, theirs are reoccurring. And it also cuts down on them having these painful episodes. So when this program was developed, it was really an effort of having people who would self identify as being Black or African American, because we also know that our fellow African Americans, or what we would call Black people, like Caribbean people, do not necessarily identify as being African American. So we say Black or African or African American. There was a blue tag. And so when you went to donate blood, you would be offered a blue tag. And this blue tag would be attached to your blood donation. And this blue tag would go directly to a child with sickle cell disease at the Children's Hospital of Philadelphia. So the most wonderful thing is knowing that blood donation in our region that comes from Black or brown people would stay right here in the region to help children. And so I know for me, that was one of the reasons that I became a blood donor, and that program became so near and dear to my heart, because I knew that I was helping someone right here, very local, with that transfusion. And so from one donation, 3 children can be helped, or 3 units of blood can be given to a child with sickle cell disease.
That's incredible. So when, you think you can't make the time out of your day, I know at my, gym a few times a year, they hold a blood drive. So any opportunity, this is just a real push for people to donate. And, just hearing you talk today, now I get a sense of why you and our founder, Peggy Dolan, are such kindred spirits.
Yep.
Kellyanne,
absolutely.
Kellyanne, needed, countless blood
Blood
transfusions.
transfusion.
And that really, down the line, after we were created as a foundation, created a lifelong legacy of partnership with the Red Cross and the Donor Fund and
Absolutely.
Peggy. So happy to have you on board.
Yes.
You've got some great tips I want to get into, because we know that this is an inherited disease. We know there is no cure. We know that overall wellness can reduce maybe the severity or the numbers of sickle cell crisis. But give us your wisdom. Let's talk about these important tips for parents.
So these are my 3 must-have for parents. And this is whether or not you are parenting an infant, a toddler, a child, or a tween, teen, or in between, right? This goes from the gamut, because I am still parenting young adults with sickle cell disease. But there's some things that I want you to be able to take away from this. And the first one is to please, I beg of you, to never, never, never ignore a fever. If your child has a temperature of 101, you must seek medical attention immediately. Every family with a child or individual living with sickle cell disease must have a thermometer in their home. It's a must. Even when you travel, right? You must have a thermometer. And if you just think about this whole thing of fever, I can recall a vacation to Disney World, right? And I just knew something didn't look well with my son, and I took his temperature, and we had to go to the nearest emergency room. So, even if you're traveling, you always want to kind of know in advance, what should I do if my child gets sick? Where should I go? The other is to go to all doctor and medical appointments as scheduled. It is vitally important that your child's hematologist or general practitioner or even pediatrician needs to see them when they're well, right? So we don't only go to the doctor when we're sick, not even as people who don't live with sickle cell disease. That's why you have annual checkups. Your physician needs to see you when you're well and doing your best, so that they have a comparison to look at when you're not feeling well and maybe not living at your best, right? You also want to share any concerns or new symptoms that you have. Make sure that your child takes all their medicine as prescribed, which is very, very important when we deal with sickle cell. And the biggest crisis that we talked about is that painful episode, right? And so most often when that pain occurs, our children, even as small children, need to be put on some type of opioid or pain medication. And we already know the stigma that's attached to the opioid and the opioid crisis that's going on right now, right? So it is very, very important that they take those medicines as prescribed by the doctor. It's also very, very important that you know your baseline. So as we mentioned, Linda, right now, my son is currently in the hospital in a painful sickle cell crisis. But the first thing I asked him as a young adult, what are your numbers, right? You have to know your numbers. You have to know what your normal is. Because if you go into a facility that is not well versed and does not know anything about sickle cell disease, which in 2021, that is very, very possible, they may say to you, oh, your hemoglobin is only at 7. That's dangerous. And you'll be able to say, no, I have sickle cell disease and my normal base hemoglobin is 7 or 7.2, whatever. But you know those numbers. Know your pulse ox number. That is how much room air oxygen you can breathe in on your own. So you may look at my son and say, oh, your pulse ox is only 92. That's really low, because generally most of us are at 99 or 100. And he can say to you, no, my normal base is 94. That's what I breathe every day. So that's very, very important. I also think that as children, we don't tend to talk to our children about their disease. We kind of want to keep it hush hush and, make them think that they are quote unquote normal, which they are very normal, but they're normal living with sickle cell disease. That is their normal. So we want to try to educate our children as much as we can about their disease so that they are at the best advantage to take care of themselves. And even as your child is growing up, there are some things that as parents we want to do for them, but we need to begin to bring them in and help them to be able to take care of themselves. Which leads me to my third and final point. Speak up. You are your child's first and best advocate. When something does not look right to you, when something does not sound right to you, when you feel like you are being dismissed, then you need to speak up and make sure that your voice is the voice that's being heard. I have been in the ED, I can't even count how many times, right? And something is going on with one of my sons, and they just say, "Oh, it's just a sickle cell disease." No, this isn't what normally happens when he goes into a pain crisis with sickle cell disease. Mm-hmm. So I need you to dig further and not be afraid to speak up and advocate for your child.
That is the most critical, excellent advice. With the short story I opened with the show today, and talking to a mom who was being exactly what you said, being dismissed in that same regard, and knowing that this wasn't normal and the treatment that was being prescribed was not what was going to help her daughter. So that advocacy. Well, Tracy, you and your husband and Village have done your job, because I know your sons are incredible advocates for themselves. They get out there, they speak, they educate, they raise awareness, particularly about the blood donor program. I know they've done talks at your church. So critical, so important that they are the ones that ultimately know their own bodies the best and can advocate as young men. So I want to thank you. You have shared such wonderful information, tips, wisdom. And maybe we just close by sharing any other resources out there in the greater Philadelphia area that you want to give a shout out to, that someone could access.
Right. So for any parent or any individual living with sickle cell disease, the Sickle Cell Disease Association of America is your best ally, right? That's where all the up-to-date information is being shared. And then there are chapters of the Sickle Cell Disease Association. So we have the Philadelphia Delaware Valley chapter right here in Philadelphia. If you are a part of a hospital network, check to make sure and see if there's a parent group available there. I know at the Children's Hospital of Philadelphia right here in our city, we have the Sickle Cell Parents Network, where parents get together. We have town halls, we have guests who come in, special discussions about what's going on in the sickle cell community. A lot of research is being done right now. Sickle cell disease is not what it used to be, right? Many years ago, it was a death sentence, to be as blunt as it was possible, right? And now we have adults living well with sickle cell disease. And if you are the parent of a child in transition, meaning going from pediatric care to adult care, there is a wonderful foundation called the Crescent Foundation, which is now serving as a bridge from that pediatric world to the adult world. And what's so spectacular about the Crescent Foundation is it was started by 3 young adults who are living with sickle cell disease. So who best to get that information from? But just know that there are resources out there and they are available, and just go to them. Use them as your guide.
Absolutely. Wonderful. Can't thank you enough for spending some time with us today.
It's been my pleasure. It's been my pleasure.
Healing vibes to your son. Enjoy the rest of your summer, and we will see you soon.
Thank you. Thank you so much for having me today.
Thanks,
it's been
Tracy.
My pleasure.
Have a good one.